Hi, my name is Dr. Rudra Mohan, and through the Oral Health channel today we are going to be talking about burning mouth syndrome. Let's start. So this episode has been on my mind for a very long time, and it took me a little bit more time to research on the topic of burning mouth syndrome. Burning mouth syndrome, as the word suggests, is a sensation of burning or oral burning in the mouth, which usually really impacts the quality of your life. Initially, burning mouth syndrome was supposed to be considered typically as a psychological or psychogenic pain. That means it had a psychological aspect about it, and it was basically because of the fact that there were no symptoms, particularly no particular local or systemic etiological causes or laboratory findings that we could ascribe it as the cause of the burning sensation, and that's why it was initially considered as a psychogenic condition. But nowadays, we've done a lot of studies over the years. Now it has come under the category of painful craniofacial neuropathies. That means it is something related to neuropathic pain. So burning mouth syndrome can be of two types. It can be either primary, that is psychogenic in nature. That means there is no particular local or systemic cause that can exacerbate the burning mouth syndrome. At the same time, you have a secondary burning mouth syndrome that has an underlying cause that could be either poor restorative or dental work, candidiasis, local factors such as ulcers, Sjogren's syndrome, systemic factors such as vitamin deficiency, diabetes mellitus, nutritional deficiency, so many things that are there. So when it comes to secondary BMS or secondary burning mouth syndrome, it is most likely associated with an underlying cause. And the treatment as such is also the same, that you identify the underlying cause and treat it, and most likely you will have any sort of resolution for the BMS. Coming to the symptoms, BMS categorically is burning mouth syndrome. That means it causes oral burning sensation, especially in the anterior 2/3 of your tongue, your anterior hard palate, at the same time your gingivae and the lower lips. And usually the patients don't have a problem sleeping. And they say that while they are sleeping, that there is no particular problem, that their sleep is disturbed because of the burning sensation. Again, it is also alleviated. The pain is curbed or it is mitigated with the help of eating food. That means when the patient is having burning mouth syndrome, there is a definite resolution or the diminishing of the symptoms when they are eating food. It's relieved by eating foods, especially cold foods or cold drinks. Also, there is associated dry mouth seen in most of the cases. At the same time, a taste perception alteration, which is known as dysgeusia, meaning that the patient complains of foul or metallic or bitter taste. Also, there is a category of people known as super tasters who really frequently encounter BMS because they have enhanced ability or capability of getting or perceiving the taste faster than most of the people, and these are more susceptible to burning mouth syndrome. When it comes to gender predilection, it's as harrowing and shocking as 33:1 in the favor of women, especially postmenopausal or perimenopausal women, because of the fact that the pathophysiology that has been associated for this kind of a problem in perimenopausal or postmenopausal women is that the fact that there is a dip in the hormonal steroids that actually affect the nerve endings and make them more excitatory towards any sort of irritation or in general neuropathic pain. Now, coming to the management, it's very simple. If it is a secondary BMS, that means it has all these causes that are causing the burning mouth syndrome. You've identified the cause and treat it. But if it is primary BMS, you have to make sure that you have to counsel the patient, take a huge interview, get all the lab testings to rule out any systemic factors, and then start them on treatment. Most likely neuropathic medications work well. That is 40% of the patients with neuropathic medications are relieved. There is spontaneous remission also seen in BMS patients that happens after 3 to 4 years, and it can come back. Stress is one of the biggest factors that exacerbates BMS. A lot of times people who are stressed out, who have problem like insomnia, who have chronic fatigue syndrome, definitely also depression and anxiety. People who suffer from depression and anxiety unfortunately also have symptoms of BMS. The drugs that are used for treatment of BMS, especially primary BMS, are clonazepam, a benzodiazepine derivative that is used topically at the same time systematically or systemically, and you have other drugs such as tricyclic antidepressants, amitriptyline, and you have gabapentin like drugs which help in neuropathic kind of pain. Needless to say, if it is a primary BMS, also cognitive behavioral therapy and group psychotherapy also works with patients in alleviating the symptoms and making sure that they are made cognizant of the fact that this is not a fatal disease. This is not something that is going to ruin your life. That is very important, and this is what I keep on telling all my patients as well. In my practice, most of the cases of burning mouth syndrome that I've come across are usually secondary BMS, which usually manifest as xerostomia, candidiasis, iron deficiency anemia, peptic ulcer disease, digestive problems, or nutritional deficiency. So this was today's episode. Please like, share and subscribe, and do press the bell icon button for important updates. If you want to contact me for a consultation, kindly refrain directly from calling me. Here are my social media handles and here is my WhatsApp number. You can drop me a message and we can have a discussion for further queries. If you want to leave any sort of feedback, criticism or queries or apprehensions, please be welcome to do so in the comment section. So that's it for today. Thank you.